Thank you for coming out on this rainy Saturday. That seems to be the theme for this spring in Pittsburgh. And so I want to thank Dr. Lopes for asking me to speak. And as you can see from the first talk, the eye is a pretty complex organ. And in order to have good vision, you really need to have three things. You need to have a clear media or a clear lens. You need to have a fairly healthy retina. And then you need to have a healthy optic nerve that transmits all the information back to the brain. And so today's talks are trying to cover the three main causes of vision loss that we see, and that's macular degeneration, cataract, and glaucoma. And so I'm going to talk first a little bit about cataract. Now, people wonder what a cataract is, and it's just a clouding of the eye's own natural lens. And you can see if you look at this picture, that's pretty cloudy. And so if you're trying to look through this lens, you're not going to see very much. And that's a pretty extreme example of very cloudy cataract. The word cataract comes from a Latin word for waterfall. And it was thought to be possibly you're looking through running water, which would be very white and murky. And so that's where the word comes from. And it's really a normal part of aging. It's just a decrease in the clarity of the lens. It's nothing abnormal forming in the eye. Now, some people get it confused. They think it's like a film or a skim on the surface. And these aren't cataracts. What this is called a pterygium. And it's frequently caused by sunlight exposure and dry conditions. We don't see these in Pittsburgh. Kind of laughing, but it's true. It's not a very common cause of vision problems in Pittsburgh. If you're in Florida or in the Southwest, these are very common causes. The next thing is, this is called arcus. This is where the peripheral cornea, the clear cap on the front of the eye, starts to get cloudy. And this is not a cataract either. Now, what are the risk factors for getting cataract formation? Birthdays. So everyone gets a cataract if they live long enough. Some people get them in their 40s or 50s, believe it or not. Other people don't have it till in their 90s. But birthdays are the main risk factors. And just like macular degeneration, family history as far as when they occur. Remember, no matter how old you are, you can always blame your parents for everything. There's some other risk factors. Diabetes. Even if it's controlled, diabetics tend to get cataracts at a younger age. And people who have had been on corticosteroids or prednisone for any length of time are more likely to get cataract formation. Now, some other things. You can get a cataract even as a child or at any age if you get a blunt trauma to the eye, such as an airbag injury or a hit from a baseball. This is an example of a traumatic cataract. You can see it kind of looks like a flower, and that's from just the blunt injury has caused the lens in the eye to become cloudy, and it can form just days to weeks after an injury. Now, what are some other risk factors for cataract formation? Smoking. You can see from Dr. Lopes' lecture, smoking is not just, it's not just bad for the lungs, it's bad for the eyes. It's a risk factor for macular degeneration and cataract. Sun exposure may be a slight risk factor, so we're all safe in this room as long as we live in Pittsburgh. You can actually be born with a cataract. Babies can have a cataract at birth, and they require surgery shortly after birth. Now, how do you know if you have a cataract? Well, some people start to notice poor night vision, or they get halos around lights when they're driving at night or around street lights. You notice they can't pick up road signs as soon as they could before. And they also start to have trouble reading smaller print. Cataract can take years to form. I mean, it can take 10 years from the time an eye doctor notices it till it needs surgery. Or actually, in some patients, they form very quickly over a few months. It can happen in one eye. It can happen in both eyes. They can happen at different times where one eye gets cloudy a few years before the other eye. But what happens when you get a cataract? In some cases, when you get early cataract formation, your reading vision actually becomes better for a period of time. because it can make you more nearsighted. So some patients find that they don't have to wear their reading glasses anymore, and they're starting to see up close, but they find their distance vision's getting worse. And this is called second sight. So again, people wonder why they're getting a cataract, but they say they're reading better. Well, during an early formation, this can happen. Unfortunately, it progresses, and then the reading starts to get worse. Now, how do you diagnose if you have a cataract? As we stressed in the last talk, it's important to see an eye doctor regularly when you note a change in your vision. You can't just assume it's due to cataract formation, because it could be due to macular degeneration or glaucoma. Another myth is cataract cannot be cured by any type of eye drops or any type of vitamins. The vitamins that help with macular degeneration don't slow up cataract formation. There's no type of eye drop that's going to clear your vision. Sometimes when you start getting a cataract, you need to get new glasses. You may have the same pair of glasses for 5 years and they're working fine. All of a sudden you notice they're not working so well. Because as I mentioned earlier, cataract makes you more nearsighted. So some people get a rapid change in their eyeglass prescription. And when you're getting a cataract, you can go ahead and change your glasses if it helps your vision. It's worthwhile doing. Surgery is really the only way to improve your vision when a cataract becomes cloudy enough. Now, it's also important to note, just that you're told a cataract is forming, it doesn't mean that you have to have surgery right away. It's not going to harm the eye. It's really only when the decline in vision starts to affect the things that you want to do, such as reading, driving, or golf, that you want to consider having surgery. Now, how is surgery done? It's actually done in an operating room, frequently at an outpatient surgery center, or sometimes still at the hospital. But it's done in a sterile environment. It's usually done while you're awake. Sometimes you're given sedation. The eye is either made numb with anesthetic drops, or sometimes an injection is given in the lid. And here's an example. The surgery is done operating through a microscope, because as you can imagine, the eye is fairly small, and it's very precise surgery. It's done in sterile conditions. It's very high-tech. These days, cataract surgery is frequently done through a small incision, which is only 2 to 3 millimeters in length. And the incision is made right where the white part of the eye meets the colored part of the eye. When you make an incision in the eye, the front of the eye is filled with a fluid. So after you make an incision, normally that would collapse. But there's a substance called viscoelastic. It's a jelly-like substance that kind of keeps the eye formed during surgery. Now, in order to get the cataract out, we make a circular tear in a structure called the capsule, which is a support structure for the cataract. And then the cataract's actually removed with ultrasound. Most people think it's done with laser, many people do, but it's not yet done with laser. Ultrasound is used to break this cloudy hard lens up into tiny little pieces and vacuum the pieces out of the eye. I mean, some of you may remember years ago cataract surgery was done as an inpatient. You had to spend a week in the hospital and had to have sandbags on your head. One of the reasons it was like this is because they used to have to make a 10 to 12 millimeter incision in the eye to get the cataract out. Because that's how big a cataract is. It's about 12 millimeters in diameter. And so in order to get that 12 millimeter lens out of a 2 millimeter incision, it's broken up into tiny little pieces, and then these pieces are vacuumed out. After the cataract's vacuumed out, a lens implant is placed into the eye. And this goes in the same place that the cataract was taken out of. And this is what a lens implant looks like. You can see it's kind of shaped like your eye's own lens, but it has these two little arms on it called haptics that help hold it in position. So it's not sewn into the eye. Now, using these small incisions, sometimes you close it with a suture, sometimes you don't. It's not really that much of a big deal. If you're a very active person, sometimes the suture is put in just kind of for protection. Sometimes you don't need it. You're usually sent, the surgery only takes about 30 minutes or less. You usually go home within an hour of surgery, and you have to wear a protective shield over the eye. You do have to use antibiotic and anti-inflammatory drops for up to a month or sometimes longer to help it heal. That's actually one of the biggest hassles with cataract surgery. The surgery only takes about 20 minutes, but you are using drops for a whole month afterwards. Let me talk a little bit about the implants. I mentioned in almost all cataract surgeries, an implant is placed in the eye at the time of surgery. Prior to the late 70s, early 80s, implants weren't commonly used. So patients used to have to wear either very thick glasses or contact lens after surgery. And this is an example of the thick glasses people used to have to wear after cataract surgery. You don't see people with those that much anymore. 20 years ago it was common to see a lot of people with the Coke bottle glasses, but now it's fairly rare. Just going to touch briefly on types of implants, because this is a fairly a newer development. Most of the implants that we put in an eye allow a patient to see clearly at one distance. You can either kind of adjust it for distance or adjust it for near, and then they have to wear glasses for the other distance. In other words, if your implants are good at distance, you still have to wear reading glasses. Over the past 4 years, they've come out with multifocal implants, which kind of try to work like a bifocal and give you both distance and reading glasses. They're not totally perfect, so they don't truly give you 100% as good a distance vision as you do with a monofocal implant. And for that reason, lost my slide. AV person still here?
I'm not an AV person, but let me take a peek.
Yeah. I think it's, yeah, it's, yeah.